following an investigation by KFF Health News raising questions about the measles outbreak in Texas earlier this year and whether more could have been done to contain it.
Now, we know at least 2 unvaccinated kids died during this outbreak that started back in late January. More than 760 people got sick total. KFF journalists interviewed CDC officials, and they found those workers felt restrained from helping. So joining us now is Amy Maxmen, the reporter on this investigation. Amy, thank you so much for joining us. I want to start by asking you, what did you hear from CDC officials that you interviewed about how they were able to respond to this measles outbreak?
Yeah, so for this investigation, I both spoke with a number of CDC officials who had to speak without using their names because of they're afraid of retaliation. And I also should say I sent Freedom of Information Act requests to health departments so that I could see what the health departments in Texas were saying as this transpired. And so the two things together put together this story where the CDC officials, these are the experts at the CDC, this was in the period when measles was really exploding in West Texas, before it became the biggest outbreak in 30 years. These CDC scientists really felt hampered from speaking, and that's because at this time, we know that the Trump administration was asking to pull down data from websites. They were not allowing reports on various aspects, such as the bird flu and an influenza, to come out, and they were laying off just dozens of experts at the CDC. So during this time, there was a lot of turmoil, and the CDC scientists told me that they did not have a green light to speak, even privately with the health officials who were on the front lines of this outbreak. Like I said, on the other side, I could see emails from the local health officials just saying, we think this is going to be really large. There's signs this is larger. Can we speak with the CDC?
So when it comes to the roadblocks, Amy, that these CDC officials were facing, it sounds like they were kind of caught in the middle, being told to do one thing, but seeing data that said another?
Actually, so the data as far as cases go was pretty clear, and that's being transmitted. So that's confirmed cases. But what the frontline local health officials knew was that a lot of people weren't testing their kids for measles, and there was a lot of kids that had measles symptoms. For example, there were 2 schools that closed because so many kids were out because they had measles symptoms. So they knew there was a lot of cases going under the radar. So the data, which is just the number of cases, was just an undercount.
So bottom line, how did what was going on at the CDC and the folks that you spoke to who said they were afraid to act, afraid to get involved, affect the actual response on the ground in Texas?
Well, it meant these frontline health workers who already are in very underfunded health departments were really left on their own. And the state of Texas did, send some help and did try and communicate. I don't know the full extent of their efforts there, but they were really left to handle this. And it's a huge amount of effort for health departments that's needed, and also hospitals were really beleaguered. You see that, and I saw that in the emails where they're saying we're, paying a lot for this. We're at capacity. Everybody's been working overtime without pay. And it meant that they didn't have the resources they need to contain this. And, you mentioned the 2 children that died in Texas. The outbreak also spread to New Mexico, where an adult died, an unvaccinated adult died of measles. It spread to 4 states, and it spread to Mexico, which is now facing a massive outbreak where there's been at least 16 deaths. So, even just Texas alone is the biggest in 30 years. That doesn't count these other outbreaks that it sparked because it wasn't contained at an early stage.
Yeah, the reach of this seemingly huge. Quickly, Amy, because we have to let you go, but has the CDC responded to this? Has the agency itself responded?
I wrote the agency, spokespeople at the agency for response. I also wrote wrote Health and Human Services for a response, and neither of them have responded to my emails with queries.
Yeah, there is a lot of fear out there. We've heard that from others as well. Okay, Amy Maxmen with KFF Health News, thank you so much for joining us this morning. And I know you'll continue to keep tabs on, at least I would assume, on what's going on at the CDC. Thank you.
Thanks.